Hello everyone, my name is Disha and I'll be talking about the microorganism OPISTHORCHIS, which is classified under the GI Trematodes. So moving on, the content page includes introduction, pathogenesis and clinical manifestations, the life cycle, its laboratory diagnosis, the treatment and its prevention. So the liver fluke OPISTHORCHIS infects the liver, the bile duct and also the gallbladder. OPISTHORCHIS is a liver fluke belonging to the OPISTHORCHIdae family, primarily OPISTHORCHIS viverrini and OPISTHORCHIS felinius. High prevalence in areas where consumption of raw or undercooked freshwater fish is common. OPISTHORCHIS viverrini, commonly found in Southeast Asia, particularly in Thailand, Laos, Vietnam and Cambodia. Whereas OPISTHORCHIS felinius predominantly found in Europe, particularly in Russia, Ukraine, Kazakhstan and Italy. So moving on to its classification, it belongs to kingdom Animalia, phylum Platyhelminthes, class Trematoda, subclass Digynia, order OPISTHORCHIDA, family OPISTHORCHIdae and genus OPISTHORCHIS. So the description of the microorganism: an adult OPISTHORCHIS viverrinis body has a lancet-like shape which is translucent and is flat like a leaf. They are hermaphrodites, which means that they have both male and female sets of the reproductive systems. It contains two suckers, which includes an oral sucker and a ventral sucker, which serves as the attachment organs. It is attached to the seminal vesicle, which is a coiled tube that ascends to the ejaculatory duct. The ejaculatory duct opens through the genital pore. In front of the testes are two ovaries that combine to generate several lobes. Between the two testes is an excretory bladder which resembles an S-shaped sac. The majority of the remaining body spaces, as you can see, are occupied by the vitellaria, which is a highly branching glandular organ that is commonly referred to as vitelline glands. So moving on to its pathogenesis, it includes 8 steps, where firstly is ingestion. Humans consume raw or undercooked freshwater fish containing an encysted larva. Secondly is excistation, where in the duodenum the egg cyst releases juvenile flukes. Thirdly is migration. These juvenile flukes travel through the ampulla of Vata to the bile ducts. Fourthly is mechanical damage. The movement and attachment of these flukes causes mechanical irritation to the bile ducts and damage to the epithelial lining. So the 5th step, which includes obstruction, the presence of numerous flukes can lead to obstruct bile flow, which leads to cholestasis. This cholestasis induces an chronic inflammation where eosinophils, macrophages and lymphocytes are released. This chronic inflammation leads to fibrosis and the thickening of the bile ducts. The bile duct hyperplasia, which is the continuous irritation and inflammation, can cause hyperplasia and periductal fibrosis, which increases the risk of malignant transformation. So clinical manifestations includes 3 phases, which is acute phase, chronic phase and severe complications. Acute phase includes fever, right upper quadrant pain, fatigue and malaise and eosinophilia. Chronic phase includes cholangitis, pancreatitis and cholecystis, whereas severe complications includes cholangiocarcinoma and also liver cirrhosis. So the life cycle of OPISTHORCHIS, it needs 3 hosts to complete its life cycle. First host is the freshwater snails, second host is the freshwater fish, and third is, which is the last host, are the mammals, which includes humans, cats and dogs. People with OPISTHORCHIS viverrini infection transfer the trematode's eggs into the freshwater bodies through their feces, where snails can consume this and carry on the life cycle. So for lab diagnosis, there are 3 diagnoses which can occur in the lab. Firstly is microscopic examination, the detection of eggs in stool samples. Secondly, imaging. Ultrasound, CT and MRI scan can take place to detect these parasites. And serological test, detection of antibodies against OPISTHORCHIS species. So the 3 treatment which can take place are anthelmintic treatment, which includes the inositol and albendazole which are effective in killing the adult flukes. Symptomatic treatment, which is managing symptoms and complications such as antibiotics and for cholangitis, and surgical intervention, which may be necessary for severe complications. So the prevention which can take place are public health education. People need to be educated about the sanitation and the risks of consuming undercooked or raw fish, improved sanitation. These are the measures to prevent this contamination of water bodies with feces, and safe cooking practices, promoting the thorough cooking of fish. To conclude, effective management of this OPISTHORCHIS infection requires a multifaceted approach involving the proper diagnosis, its treatment, and its appropriate preventative measures.